So we're now going to, before coffee at 11 o'clock, we're going to move on to Scirocco and tell you the journey that we've been on from its inception way back in the B3 Action Group to a validated tool. So Andrea's going to give you the introduction and Lisette will follow with the journey that we've been on around validation. And then we'll break for coffee at 11 o'clock. So I'll just say goodbye to our three speakers here and thank you very much.
Thank you. Bye.
And hand over to Andrea.
Thank you very much, Donna. Good morning, everyone. My name is Andrea Pavlickova, and alongside with Donna, I have a pleasure to coordinate Scirocco project. So Scirocco is the EU Health Programme funded project which addresses the challenge of the need to better understand the local context and local conditions for implementation of integrated care and scaling it up. So in my brief presentation, I'll just give you a bit of rationale for this project, a bit of information about the objectives, and more importantly, how we moved from the conceptual model to an online self-assessment tool. So for me personally, the Scirocco project is a great example how initially voluntary collaborations of the regions and organization can result in a funding opportunity or a support with the funding. It is also a great example which emphasizes the need and importance of the networks and platforms which facilitate knowledge transfer and brings together stakeholders to really work together on the common objectives and common aims. And definitely from Scirocco perspective, it would be the European Innovation Partnership on Active and Healthy Aging. Similarly, as Philip mentioned in his introduction, this partnership, for those of you who haven't heard about it, is the initiative that was launched by the European Commission back in 2012 to address the challenge of aging population. And within this group, we also there is a strong representation of the actors in the areas of integrated care who comes together on the voluntary basis to work out on the solutions how to replicate and how to scale up integrated care. Throughout the experience that we had in this B3 group, we have identified a couple of challenges of implementing and scaling up integrated care. As Nuria mentioned in her introduction, there is hundreds of good practices, number of repositories of evidence and different assets of integrated care. But how do you make the sense of this information? How do you know which evidence is actually relevant to your local conditions, to your local context? How do you know which aspects of the good practices are really transferable to your local situation? And more importantly, where do you go for the support if you want to improve the situations in your regions? And all these questions make us realize that we actually are lacking the tools and frameworks that can help us much better to understand these very complex processes of scaling up and implementing integrated care. And that's how we really started working on or thinking about the need for some sort of a conceptual model, or what we call at that stage maturity models, which would help us to access the learning in the current evidence on integrated care and also access the support and the solutions that are actually addressing our local needs. So our journey started back in 2014 when we started the work on the maturity model. And as I was mentioning in my introduction, it was a voluntary collaboration of the members of the B3 Action Group. So we had 12 regions who volunteered to participate in the interviews, which were facilitated by the IBM, who was also at that point the members of the B3 group. And we have asked these regions what was their journey towards integrated care. And as you can see from the list of the regions, we didn't only go for those who were really, much more progressing, but we really tried to also go with those who are just about to start the initiatives, coming from a different geographical background, so that we really have quite complex range of information. We have then analyzed those interviews, and as a result, we have grouped the outcomes in what we call 12 dimensions for integrated care. I know you can probably read them from the slides. So they cover areas such as readiness to change, governance, funding, capacity building, support, citizen empowerment, innovation management, and so on. In the next stage, we then were thinking how we can actually turn this conceptual model in some sort of the model that give us a bit of information around the difference in the maturity and difference in the progress on integrated care. So each of these dimensions we then broke out in the assessment scales ranging from 0 to 5, which identifies those different levels of maturity. And we went through all 12 of these dimensions. However, we realized that if we want to develop a robust model that would really help regions on the journey towards implementation and scaling up, that we need further testing and further validation. And that's where the whole idea of the Scirocco project started. So out of that voluntary collaboration, we brought those regions and organizations who helped us to develop the maturity model and applied for the EU funding. So since 2016, we started our Scirocco journey. We are a relatively small consortium of 5 national and regional healthcare authorities. So we have Basque Country in Spain, we have Norrbotten region in Sweden, Puglia in Italy, Olomouc region in Czech Republic, and Scotland. And we equally have the contributions from European universities and network organizations helping us with the evaluation and dissemination. However, throughout the project, we were really successful in engaging with our external partners. We have currently tested the tool with over 50 regions in Europe and also beyond. We have worked with a number of European organizations and projects who have really helped us a lot with testing and validation of the model. And I would like to use this opportunity to thank you all for a great collaboration and for all your inputs to actually getting us to reach the ambitions of the Scirocco project. In terms of our objectives, so I mentioned that really the driving force was the need for testing, need for validation, but also trying to think how we can turn this conceptual model into something which is more user-friendly. And that's where the idea of online self-assessment tool started. And again, there will be a dedicated session where you will hear about much more in details about the development of the tool. But what I would like to emphasize at this stage to set the scene for a day is that this is not the evaluation tool, it's not the objective measurement, but it's really kind of like self-assessment tool that tries to capture stakeholders' perceptions, stakeholders' experience and understanding of how integrated care is implemented in their local context. We believe that such a tool can help us to facilitate scaling up on integrated care by using it for 2 main functionalities. First one is around the assessment, so it's to address that challenge to better understand what it is actually that we can transfer and are we ready for that transfer. And the second functionality then brings this information together and we try to basically see if understanding of this local situation can help us to facilitate much more tailored discussions among the stakeholders, much more effective knowledge transfer, and ultimately much more effective transfer of information necessary for twinning and coaching. And I will not speak more about these functionalities. I will just rather set the scene for the following three sessions where you will basically hear the practical experience of our regions, how they tested and validated the tool for 3 purposes. So the first one will be around the maturity assessment of the maturity requirements of good practices. Then it will be assessment of the healthcare systems for integrated care. And in the third session, you will then hear how the tool has helped us to facilitate twinning and coaching. And towards the end, we will share with you our experience in the forms of lessons learned and what are some emerging policy implications and policy findings. So without further ado, I would like to now pass to my colleague, Bear. Sorry, I thought that Bear was supposed to be with us, but no, it's Lisette, who will speak about the validation and evaluation of the tool. Thank you.
And Lisette, you are most definitely not Bert.
No, that's true. So, good morning, everyone. I'm Lisette, and I'm a researcher at the Vrije Universiteit Brussels. And together with Professor Bert Vrijhoef, we worked on the evaluation of the Scirocco tool. So I think we are all here looking for valuable insights in elements which work for integrated care. However, unfortunately, these insights are a bit hard to find. This is partly because there's an insufficient evaluation of integrated care interventions. This means that there's a lack of evidence to know which elements support integrated care. And in addition, there are a lot of tools available assessing integrated care. However, many of them have been poorly validated. So this means that even if you would like to assess your integrated care intervention, you don't know whether the tool you use adequately measures what you're looking for. So the Scirocco project focuses on the need to understand the context and environment of integrated care interventions. And the starting point of the strategy uses the B3MM to measure the maturity or assess the maturity for integrated care. So since the tool was newly developed, there was a need for validation. So we looked into the reliability and validity of the tool. And this is important to gain those insights because it will help you to understand whether the tool assesses what it's supposed to, so the maturity for integrated care. And there are several aspects of validity and reliability you can assess of tools. And we performed an assessment of several aspects in several steps, which I will present to you next. So first we looked into the content validity of the B3MM. So we wanted to know whether the content of the B3MM, including its 12 dimensions and assessment scale, reflect what they are intended to. So to test this, we conducted a literature review and a Delphi survey. And we found that the B3MM includes a wide range of dimensions and measurement scales which reflect maturity for integrated care. So in the second step, we looked into the structural validity. So we wanted to know whether the Scirocco tool was constructed in a way that it adequately assesses maturity for integrated care. So we tested it by trying to provide answer to the question, do all of the 12 dimensions contribute to assessing maturity for integrated care? And we performed a quantitative analysis on 67 collected questionnaires. And we examined the structure of the tool in this data set. And the results showed that all the 12 dimensions of the tool contributed to assessing maturity for integrated care. So we also looked into the convergent validity. And if you want to assess this, you take two tools which are supposed to measure a similar concept and look whether they are related to each other. And to compare the Scirocco tool, we compared it to the development model of integrated care, QuickScan. And we found that 1/3 of both tools were related to each other. However, we found that the largest part didn't show any relation. So this means that the instruments measure different aspects of maturity of integrated care, and that the Scirocco tool might provide a new contribution to assessment in integrated care. So besides looking into the validity of the tool, we also assessed the reliability, and we looked into the internal consistency, and we wanted to know whether the responses given to the tool by the stakeholders on the 12 dimensions were consistent with each other. And we also performed a quantitative analysis on the 67 collected questionnaires. And we found that the Scirocco tool consists of a good internal consistency. And we're currently working on the step 5, which is a test retest assessment. And for this, we are collecting measurements with the tool. And we asked stakeholders to assess their maturity once and ask them to repeat those measurements. And then we are interested to see whether they gave similar level of answers to both measurement moments. And this is referred to as test retest reliability. So in short, what have we found? We found initial support for the Scirocco tool in assessing the maturity for integrated care of the healthcare system context. We need to be careful when interpreting these outcomes because the sample size used for the analysis was moderate. So we recommend to use a larger sample size to test those measurement properties again to confirm what we have found. And furthermore, since the tool is also used for the good practice assessment and also used in different languages, we also recommend to also test the validity and reliability when the tool is used in for those purposes. And our take-home message is that the Scirocco tool offers regions a tailored approach facilitating integrated care, progress in integrated care. And it's really important to assess the validity and reliability to ensure that there's a valid measurement of the maturity for integrated care.